Hello, and welcome to part 3 of When Docs Talks special series on orgasms and women's sexual health, the ABCs of OOO. We're excited that you're joining us again today. Today, we're going to be talking about some of the new medications and advances in women's sexual health. Did you know about something called the Scream Cream? Neither did we, but our experts are going to break it down. We'll also talk about barriers to sexual desire, which we've learned is a major problem when it comes to women's sexual health. Our gynecologist and our psychiatrist will let you know the ins and outs of that. And let's not forget to talk about that O shot. Welcome to When Docs Talk, the ABCs of OOO.
When docs talk, when docs talk, when docs talk, when docs talk. When docs talk, 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 when docs talk.
All right, we are back. If you're just joining us now, you are in the right place if you came to talk about orgasms, women's sexual health, and everything that goes in that category. All right, so let's jump into what we came to talk about. We came to talk about the ABCs of OOO. We want to know what you know about the big O and what you'd like to know about the big O. And in that, we are here to answer any questions you have, but we're also going to be joined by people that this is their specialty. They have so much wonderful knowledge to impart to you.
Talking about the O, but we have to realize that satisfaction does not always for women mean the big O.
Right.
Oftentimes it doesn't. Every experience does not necessarily mean that. And if you look at the studies that have been done, they don't talk about, when they're asking women to fill out those surveys, they don't end with, and did you have an orgasm? They ask, were you satisfied?
Yes.
Because the
Yes.
definition is different for everyone.
Absolutely. In fact, one of the questions that we asked is sex still pleasurable if you don't have an orgasm? And well, only one male respondent said yes, but a lot of the women said yes. A lot of the women were satisfied and still thought sex was pleasurable, even if they did not have an orgasm.
But that's just like Dr. Burt said, it's because their mind was stimulated before. It's been stimulated all day. I mean, that's exactly what it is. We have to remember we are very non-physical beings as well.
Mm-hmm, mm-hmm. All right. Can I switch it a little bit? I want to talk about what's new out there because I get a lot of questions about this, and I'm also asking for a friend about all the different medications, lubes, all that stuff that's out there. And I know you all know. I've had conversations with some of the experts about this. So can we start off by talking about medications in women's sexual health? What should our viewers know about that's out there? We want to know.
So until 2015, we did not have anything out there. And
Right.
It's been 20, Viagra's been out since 99, I think, 1999.
Mm-hmm.
I think
And-
even longer. Viagra?
Yeah, well,
It's been a long time.
I don't think
Well,
99
I
is
think
about right.
the indication, because before I think it was they were using it for or trying it for pulmonary hypertension.
Right.
And then they found that that it was helping with sexual arousal.
It's been
So I think that's where it came in.
Yeah.
Yes.
And so the point is, gosh, I don't even know where the score is now, but you heard it during my bio read that I went before the FDA in 2015. I've been working with this particular company and this particular medication. I'm not here to push one thing over the other, but that's when I started learning about it, because in medical school, I didn't learn about female sexual dysfunction. If I got a lecture on it, it may have been an hour long. I don't remember. It's a blur. And it wasn't until I got into my practice, and patients were coming to me with their concerns, and I had nothing to offer them. I mean, the only thing that we had really was for dyspareunia or painful intercourse. We have estrogen, but even the indication isn't or was not for dyspareunia. It was for vulvovaginal atrophy. We now term it differently, GSM, genital urinary syndrome of menopause, and that's because of the lack of the estrogen. However, if you look at the statistic, the PRESIDE study that's so old but still so important, we know that there are women, 44% of all women, 44% of all women, doesn't matter the age, complain of some type of sexual dysfunction. But when you add the stress to it, the number one complaint of women in the world of female sexual dysfunctions is lack of desire. It's not the lack of orgasm. Orgasm, it was less than 5%, or right at 5%. And arousal was a little bit higher, like 6%. But desire was the most complaint that women had. And we also know that women have pain and things like that. But it's just important to know that the medication, we're behind. There are now 2 medications for desire. I'm trying to think that somebody was telling me about something that's coming down the pike, but as of today, there's a pill and there's an injection, a shot that women can take before they want to be active. And that is an injection to increase their desire. And then when you think about arousal, there's no FDA approved medication for arousal.
Dr. Pierce, you had mentioned something about the pill. I want you to say the pill and tell us what it's supposed to do, because we had a conversation, so we want to know. You want to tell us a little bit more about that?
Sure. Well, the expert on it actually is Dr. Britt. She actually was the one who went to the FDA and talked about it. So she really should be the one to introduce it. And I can tell you from my end what my patients are getting from it after she does that.
Sure. So the medication is called Addyi, ADDYI. Addyi is a pill that works. They dub it the little pink pill. But it doesn't work like the blue pill. It doesn't work like Viagra works, because Viagra is on demand. Whereas Addyi, you have to take it. It's a nightly dose or at bedtime dose. And the point of it is to help women who have lost their desire or decrease the frequency of their desire. So they're not thinking about it. They're not even receptive to it. When they're getting that nighttime tap on the shoulder, they're like turning over and don't want any parts of it. And Addyi changes that. So it works in the CNS. It works along the serotonin pathway. Serotonin, the neurotransmitter serotonin, when you do have intercourse and you do reach orgasm, serotonin is released and gives you that satiety where you feel satisfied. And so what Addyi helps to do, and of course the disclaimer is we don't know exactly how it works in the CNS, but we do know the 5-HT1A and 2A receptors is where it works, where it helps you to overcome that I don't want it phase. So patients, 60% are responders. So patients are thinking about it. They are at work. Oh, I'm not going to go to my girlfriend's. I need to go home. Where they And the average woman has been married or in a relationship, in the studies, about 11 years in a relationship, and at least for 6 months where you have just lost the desire. Hypoactive sexual desire disorder is what it's called. So that's Addie, the long and short of it. But it has some other great benefits that
Right. And actually, yeah, I think that some of the other benefits you mentioned are that nobody knew about. And thank you so much, Dr. Julianne, for introducing the medication. We're interested to hear, what are those side benefits and what are some of maybe the potential downsides of it?
Well, for some of my patients, what they're finding is that they're having increased sleep. So they're having better sleep. So it's dealing with their insomnia. We have less irritability. We also have, I'm going to say, less mood swings. And again, that has to do with the serotonin that Dr. Burt just discussed. Serotonin is what I call your happy neurotransmitter. And if you have enough serotonin in your brain that's floating around, then you're going to be less irritable. You're going to be less moody. You're going to be able to enjoy things more often. The other things is, of course, obviously, we have the increased lubrication that women are experiencing. And besides just the arousal part, they are actually enjoying it. So now you have what we've been talking about, the pleasure part. So you have several different moving parts in this one pill. So it's almost like the magic pill for us right now compared to what we've had to wait. I mean, we had to wait. Men have had Viagra and Cialis for so many years, and we've had nothing. So
Yeah.
this is going in the right direction.
Absolutely.
And the other benefit, the other nice side effect in the pre and the postmenopausal population is weight loss.
Oh, yes.
Oh,
Yes.
wow.
What? Say what?
I forgot that.
Wait, did you ladies just say that this pill makes you want sex more, your arousal goes up, and enjoy it, you get better sleep, and you lose weight?
Here's the downfall. So let's not glorify it without giving the down. The downfall is, I don't see anybody with a cup in their hand or a glass in their hand. The downfall is interaction with alcohol.
Mhm.
But I see you.
We're going to slowly move the cup out of the way. And I'm going to ask what's in both of those cups. Davita and Dr. Whaley takes a drink.
But the beautiful thing is, when it first came out, there was a lot of craziness with it. You had to be certified to give it, and just to be able to prescribe it. And all of that has gone away. It's been about 3 years, 2-3 years. That's gone away. So now what we tell patients what they need to do is, if you've had a drink, or up to 2 drinks in a given setting, and it's nighttime, you want to just wait for 2 hours, and then you can still take your Addy. Okay. If you have 3 drinks or more, just skip it. You're not going to like go back down to baseline, with one night of skipping. So it has, and the side effect, I'm sorry, I'm telling you alcohol, but what does it do? It can cause low blood pressure, syncopal episodes. You're not supposed to, operate heavy machinery or go driving, don't do that. And that's why you take it at bedtime. So if you work the graveyard shift, I don't mean take it at night. I mean, take it at your bedtime. Yeah. But other than that, I just was on a call last week with some of my other colleagues from the pharmaceutical company. I can hardly find a reason to not give it. Now, there are some contraindications like liver disease, okay, but I can hardly find a reason not to give it. It is approved in the U.S. for premenopausal women. I am hoping that they're going to come out with they've already done the studies. We already know it works in a postmenopausal woman. It's not FDA approved, but just like y'all be giving them children Benadryl, we use things off label all the time. In Canada, it is approved in the pre and the postmenopausal. We're just kind of late to the game, but it is a good option for a lot of patients. I also in my office offer bioidentical hormone therapy, testosterone, pellet therapy mainly. I can do compounding pharmacies if we do creams and all that.
What
The
about
pellets
this O
are
shot?
great.
What about the O shot?
I offer the O shot under a different name, but I do offer the PRP, the platelet-rich plasma.
What is the
What
O
is
shot?
it?
What is the
What is it?
What
So
is the O
It sounds
shot?
like a drink you would have at a club till you can get home and have. Like that's
So
in your cup.
the O shot, like the P shot, basically draws your blood, spin it down, and we get the good stuff, the platelets and all the plasma, which helps to rejuvenate the cells and make them grow again. So once we do that, we take that that vial and we inject with some EMLA. I give you some numbing cream first,
numbing
but
cream.
I injected near the clitoris, not into the hood of the clitoris, on either side, and I also injected at the area of the G spot. And in a short window of time, it is for arousal. It will enhance the arousal. Some of its side effects will, its claim to fame also because of the G-spot amplification. The G-spot is an area around the urethra. So many women will get the benefit of less incontinence because after having some babies and you you may have a little leakage. And so it helps to build that area up. You know what I'm saying? So that's one thing. I do vaginal rejuvenation in my office. I'm all about this, y'all. What they didn't teach me in medical school and residency, I had to go out and learn on my own. And just like Dr. Kearse has found with her patient population, women are doing well. I mean, everything is not for everybody, but it's important for you to have the conversation with your providers. And if they don't know, find somebody who does. Please.
Yeah,
knows?
absolutely.
Don't be
Even
like
sometimes,
me.
sometimes the people, even if they don't know, find a provider who's willing to know, willing to find out, right? Willing to learn. The same way you say we're all learning these new things.
Speaking of learning, I
I know
want to
as
hear.
somebody who knows already.
I want to know, what do you guys know about this? I've heard scream cream, which sounds like it's appropriate for Halloween, right? But like, tell me more about
Calm my nerves because I'm scared. Scream cream.
Screaming, like, are we screaming happy screaming? Are we screaming?
Right,
happy.
It's a range. It's a spectrum. Okay, look, guide me.
like.
So it's a mix. It's a mixture of what is it? I'm going to say the wrong chemical. It's Viagra. There's a little bit of Viagra in it. Is it arginine or amitriptyline? It's one of those.
Arginine.
Okay, thank you.
Arginine, for sure.
Arginine, and I'm so blanking on the third one. And it's a mixture. But y'all never been to one of them passion parties?
Yeah.
I have, but they don't have Scream Cream. I've just heard of it now, and a lot of our viewers were asking, what is
no, but they sell one of them creams, y'all never tried. No, never tried that. Yeah, it enhances. You will really feel a sensation if you just put even just a little whiff
Just a little
of it.
drop.
Just a little
what kind
drop.
of sensation? Because
Why have we not heard of this? Like, why is this all new information?
It's not new information. It's not even new. It's not even new. I don't know why people are just now finding out about it, but it's not new. They've been selling it under different names for many years. I mean, Scream Cream is just one name for it.
Yeah.
So it's not a new product, and you probably have tried it. You just don't know because you don't know the other names. That's all.
And the problem, and the reason I kind of shook my head when you made that comment, doctor, not to go against our colleagues, but we're creatures of habits as physicians, and I'm going to speak to all of us. What do we say? Well, when I was in residency, or what I learned, and if they didn't teach you, that's like your ceiling almost. And I was starting to say, I want people to be more open. That's why I do talks. I do talks not only for the lay public. I go out and educate my colleagues often. I've done it on, like I said, National Medical Association. I've been to Vegas to talk. I do this because it's important to not sound like I did pre-2009 when patients would come and I would say, but did you get a babysitter? But did you make a bubble bath? You just need some time. You just need to take have time for a date with your partner. No, that's not it. Women are saying either they don't want to have sex anymore and it bothers them. Now, as a physician, I've had to learn, let not her lack of sex bother you more than it bothers her, because some women are okay. Think about it. A lot of men are dealing with their own dysfunction. So some women say, no, I'm good because he's not getting it up anyhow. So they don't want the heightened burners like the testosterone that I offer. I have patients who say, well, could you dial it down? Because I noticed the last time you gave it to me, I wanted it more, but my partner is not able to. So we have to meet people where they are, but we have to find clinicians who know. I'm going to get your information from my fellow doc here, the PT doc. I have so many women who I need to send to you. So I'm glad to hear about it. But I mean, pain, the number of women that I have right now, that it floors me to hear a woman in her 40s and 50s say, it's been 4 years since I've been intimate with my husband. 4 years. I literally had a recent patient who was having, her issue was the pain. And we were able to give her help with that, or so I thought. And she was having vaginal dryness and pain. I have patients who tell me, I do it, but I cry in the bathroom afterwards. This is why tonight, this isn't just fun and games. This is so vitally important.
Well, we definitely agree with our experts. Women's sexual health is no laughing matter. It's serious business. And we're so happy that you joined us again. We're going to ask you to join us once more. Next weekend, we're going to have part 4 of this series, and you won't want to miss it. We're going to answer all your questions that you sent in to us about everything. Remember, no topic is off the limits when it comes to this subject matter, because we want you all to be well informed. So ask your questions, and if you didn't get them in throughout this series so far, please send them to us. You can post on our Conversations with When Docs Talk page. Thank you so much for joining us again, and we'll see you next time.
When dogs talk, when dogs talk, when dogs talk, when dogs talk. When dogs talk, when dogs talk.